In this video, I answer a common question I get on why I only do soft tissue work and never do adjustments, even though I have a chiropractic degree. For those of you who don't know me, my name is Dr. Matt Maggio, and I'm a non surgical expert in chronic pain treatment using solely manual based methods. I am also the creator of the Peak Method, where we teach overworked massage therapists a new treatment system that cuts session times in half and eliminates the frustration of inconsistent results so they can avoid burnout and help more people get out of pain. All right, so I get this question like several times a week. I also get it from my patients as well. So I just decided this would be a good topic for a video. So, why don't you do adjustments even though you are a chiropractor? I'm going to try my best to answer that in the video. Just a quick reminder, I do love doing these types of videos. So if you have any questions you'd like me to answer, please send them my way. And if I think I can help, I'll get a video out to you. The info to submit your questions is in our profile or wherever you're consuming this video. So how I can't even talk, how I came to be an anti-chiropractic chiropractor. So when I was in chiropractic school, first half of graduate school, we actually work in trimesters. So you do 10 trimesters over like a 4-year period. I was all about adjusting. I thought adjustments were amazing. I thought they were so cool. I was like in the adjustment club. I was just rocking and cracking and popping, and everything just felt really cool. I didn't really get any training yet in like the science or the research behind it. I was just learning how to do it. I was like, man, this is cool. I'm cracking people's necks, cracking their backs. It feels awesome. Makes awesome sounds. I'm really good at it. This chiropractic stuff is awesome. Then I got into this class in sixth trimester, taught by a professor who I really couldn't stand. They were pompous. They were arrogant on so many levels. And it was on basically the idea of like the subluxation and what it did and the subluxation concept. Basically the idea that the bone goes out of place. It interferes with the nervous system. When you make the adjustment, you remove the interference. Um, all sounds great in theory and everything like that. But I asked a question and I said, the bone keeps going out of place, and the things that hold the bone in place are like the muscles and the tissues and the ligaments and the fascia. So why don't we just fix that instead of continuing to put the bone back in place? I look at the bone as like the brick and the soft tissue is the mortar. So I'm like, if the brick keeps falling out of place, we put it back. Why don't we fix the mortar so it doesn't actually keep falling out of place? The professor was very rude to me, questioned my integrity, and said, Matt, if you don't believe in the healing powers of chiropractic, you should probably drop out of school because this profession just isn't for you. At that point, I was already halfway in. Chiropractic school is not cheap. It's $150,000. At least I'd already spent $75,000 at that point. And I was like, oh man, what am I going to do? So I did think about dropping out, but I'm like, there's got to be a different way. So at that point, I really started getting into like soft tissue work and understanding muscles and physiology and anatomy and everything like that. I took all these additional soft tissue courses outside of my actual curriculum in chiropractic school. I took every active release technique you could think of. I took myofascial release courses, instrument courses, everything. I was really, really trying to learn on top of what I was learning for my chiropractic degree. I still did the things I needed to do to get my degree in chiropractic. I still did the adjustments they told me to do. I did clinic like they told me to do, but I was just doing what I needed to do to get through school, pass my boards, and get my doctorate. One thing about having my doctorate, which was good, is I could order like MRIs and X-rays if I needed to. That really helped as well. But I really only did soft tissue. Anytime I wasn't in clinic, I was doing soft tissue work. I was practicing on people, learning. It was crazy. I actually had like the vice president of the school. They would come into clinic and get treated by us. I had people that specifically were starting to ask for me because they knew I was doing soft tissue work and I was, really getting into it. I'm like, this stuff is awesome. I'm going to be a soft tissue person. And that's what I really decided. Even when I got out in practice, I've never performed an adjustment in practice. So I'm going on 2026 will be my 15th year in practice. And I've never actually performed a spinal manipulation in practice. And I only do soft tissue work. So here's the thing. I'm not anti adjustments. I get a lot of hate from chiropractors who are like, oh, you're not a real believer in the healing powers of chiropractic. I'm not anti adjustments. I just don't do them because I don't think they have a long term effect. I do think they're relatively safe for the most part. There is some risk. People talk about like cervical spine adjustments and the occurrence of a stroke from a blood vessel rupture. I think that's like 1 in 5 million. And a lot of times when those do happen, the person already had some other coexisting factors that um, led into that. But that's really the only like safety issue that you might have there. Maybe you can have like a broken rib from like a thoracic spine adjustment, but that's very rare as well. And a lot of times it's because they had some underlying cause as well. They're definitely effective for like acute pain when people are hurting. They get an adjustment that temporarily like reduces the pain, and it's nice to get out of pain in the short term, but they really don't have any long lasting results for like chronic pain. So a lot of times when people are getting adjustments, they temporarily feel better, but then they feel like they have to continue to go back and back and back over and over again because you're really only treating the symptoms. You're not really improving the overall function of the whole entire area because you're not addressing the soft tissue components. Then I get clients all the time and patients. I had someone the other day where it's like, hey, I was like doing an exam on their low back. And they were like, well, while I'm here, you might as well, adjust my mid back and my neck. You're a chiropractor, right? And I just kind of laughed. I'm like, yeah, my license is under chiropractic, but I'm allowed in my scope to also do soft tissue work. And that's all I do. I haven't done an adjustment in like 15 years. I'm actually not even that good at it anymore. Um, and then I explained them the idea of like the bone going out of place and the brick and the mortar. And they usually shut up about it. And they're like, okay, yeah, just do what works. Because a lot of times when people have come into me, they've already done chiropractic, they've done all those things, and they really haven't got a whole lot better. So I always say, if those treatments work, then why are you actually here? So it's okay to have those conversations. The patients and clients aren't being jerks. They're just asking because they think they want to get everything they can and they think it can help. But for me, I'm just not seeing it as a long lasting, durable type of treatment. So that's why I don't actually do it. So why not do both soft tissue work and adjustments? I get this a lot as well, where people are like, "Oh, I work with the chiropractor, and we have a great relationship. He or she adjusts them, and then they send them to me, and I do the work, and it just like couples and works really good together." Here's the thing: when they're doing the adjustment, often the area that cracks are it's called cavitation for a fancy term, is the one that's actually moving too much and it's already popping and cracking. A lot of times, the one that actually needs to be moved is locked down with all that adhesion and scar tissue in there, and it doesn't move. So you're actually moving structures and bones that are moving too much anyway. And just because it cracks doesn't mean it's actually doing something. Next is this idea called reflexive changes in symptoms, and it doesn't give us accurate data. So in your body, in your spinal cord, you have this pathway called the lateral spinal thalamic tract. And what moves up there is pain, but also vibration and movement. So when you get an adjustment, what it does is it gets these things called mechanoreceptors to start firing. They go kind of crazy. So it temporarily blocks the pain. And you feel better in a short term, but that problem comes right back because you didn't actually make a full change in the tissue. You kind of just played a trick on the nervous system. Next is just getting the treatment dosage right. A lot of times when people are in chronic pain, we think they need more and more treatment. I say treatment is like a medication. You want to give enough to be effective, but you don't want to overtreat it. So a lot of times, if I'm just doing the soft tissue work and it sets things back in place, then why do I also need to adjust it when I'm there? Like it's already where it needs to be. It doesn't need any more. And I see this a lot, especially when I'm doing like soft tissue work in a certain area where I find a lot of dysfunction. I will get some cavitations of the joint, but it's like a little, just a very small, not like everything explodes. It's a small, and that's where that adjustment actually takes place because the soft tissue is right. So it sits back in place. And then lastly, this is so important. Remember that results rule, and don't let someone bully you around just because they have a doctorate in their name. I see this a lot of times, because I train up massage therapists and I help them, and I think they have the best skills for soft tissue work, which I think is the most important type of treatment that you can do out there. But a lot of times they take a back seat to the chiropractor because, they have a doctorate and they know more. And it's like, just because you have a doctorate in front of your name doesn't mean you know much of anything. It just means you were able to go to school, pay the money, take the boards and do that. It doesn't make you better than anyone else. At the end of the day, the client doesn't care what you do or how you do it. They just care that you can do it. And soft tissue based treatments are the most safest, effective, and long lasting thing that you can do to fix a problem. That's all I got in the video. I appreciate you watching. Got any insights, share them below in the comment section. I like to comment back and forth and share information with other people, or if you have a different perspective you'd like to share, always open to new ideas and new thoughts. You also can share this with other providers that it might help. Do me a solid and share this with other people that are having a different perspective as well. And lastly, if you like what I'm teaching, what I'm training, what I'm showing, you go download our free training modules where we take you through the full process of like figuring out problems, palpation, advanced treatment, testing, all sorts of things to really help you make a shift from what I call a service provider to a solutions provider. And links to download that are in the description box wherever you're consuming this video. And I appreciate you watching, and I'll catch you on the next one. Bye.